I'm Dr. Paul Hobday, and I'm here today with Dr. Bob Gill, my co-leader for the National Health Action Party. We're talking about STPs, or the Sustainability and Transformation Plans. Some people call them the slash, trash and privatise. They are part of Simon Stevens' implementation of the 5-year forward view. And that is deliberately designed to take us to the US model of healthcare.
So you mentioned Simon Stevens. Well, he's a very interesting man. He spent 10 years of his career working for UnitedHealth, which is one of the biggest American private insurance companies. Before that, he worked with New Labour, and now he's come over to finish off the job, to take us to the American insurance system. And the way he will do this with these STP plans, well, they're designed to shut down hundreds of GP surgeries. They're designed to shut up to 34 district general hospitals and gather together all the profitable services like elective or planned surgery, and shut down expensive services that are unprofitable like casualty and intensive care and medical and paediatric services. So you're going to get this hiving off of the profitable work to centres which in due course will be handed over to the private sector.
And of course, lots of A&Es are going to go, aren't they? They're described by government ministers as the unprofitable part of the business. And we're seeing general practices closing, I think it's about 1 every 10 days. So we're going to end up with a shrunken NHS where people will have less access, they will have to travel, they will travel further to get that service, but the services will be less as well. There's a real contraction in the NHS planned.
Well, what we're having is a deliberate vandalism of services that have provided high quality, efficient care in the community, close to patients, which are easily accessible. So the deliberate destruction of good services is required by government to drive the top-up insurance market. So we mustn't be in any doubt that what is going on now will make the NHS more dangerous, will put pressure on staff, and patients will be getting less care. So we'll end up with skid row services for those who can't afford top-up insurance, and insured patients will be getting services where profit is the driving motive, not quality and not public service.
And if that wasn't bad enough, of course, it's all secretive, it's very undemocratic, and as you say, dangerous. What is important is some of this is run or going to be taken on by local government, so it's important for councillors to understand what is going on, and our belief is that many councillors don't really have a clue. It's up to the public to really lobby their councillors, educate them into what is happening, because they are perhaps inadvertently complicit with the destruction of the NHS here.
Well, I think NHA, myself and Paul Hobday are networking with experts who understand the STPs, and we have a big job of translating what is very complex so that people can understand that their NHS, their beloved NHS, is at severe risk. And we will be getting out these messages loud and clear in the coming months. So please follow the links in the text with this video, and thank you very much.